I'm sharing a journey as a patient, and I'm born in 1987, so I'm 36 years old, and we will see what happened in my life as a patient. I don't want to repeat everything. I take some points out of the presentation. I have some things that already been said, and I start. Oh, what happens? No? Just enter?
Or the space bar.
Space bar?
Yeah,
nice.
the big one.
Okay. So I have some contents. First 3 years, initial diagnosis, medical treatments, orthodontics treatment, tattooing. This is a special point. I will tell you about this. And meeting Wilma in 2020. And conclusion. So this is me as a baby. You can see this is like one, I don't know how many years old, not old. There you see me again. And yeah, it's the first 3 years. I mean, I'm born in Karl-Marx-Stadt. It's in GDR. And when I was born in GDR, they first assumed that the cause of this was Chernobyl. You know Chernobyl? Yeah, and this was the first assumption of it. But now I know all of you, and I know patients are in every age. And I know the cause by now. It doesn't have to do anything maybe with Chernobyl, but these were the first doctors that were telling me this. Some said it is swollen from C-section and it will go away like they told you, but it didn't. Yeah, first 3 years, no treatment, no medical technique. So yeah, let's go on. The first X-ray results in 1990 brought no correct outcome. Assumption was, I thought so. Lipoma encapsulated. So they thought it's encapsulated and it can be just cured by liposuction. So medical treatments, I had lots. So I will tell you about these in, I hope short. I had many. So let's start in the first ones were liposuction. I had no results. And we did it a second time in 1992. And there were no results. It was not growing back, it just didn't work. The doctor said that the tissue, the fat cells are like harder than normal ones, I don't know. So a first success I had in 1996, I was 9 years old. And this was when they were cutting out the fat cells. They were cutting them out from behind. And they didn't grow back because this whole area, they cut it all out. And so it didn't grow back at that point, at that area. Then I had some mistreatment. I mean, when you are at this journey, you are in danger to be mistreated as well. This is something you have to face. So in Basel, in Switzerland, I had a treatment where they tried to shave the bones, but it was bleeding out, and I had to have a surgery, an emergency surgery. And afterwards, my nerve on this side was broken. I can do this, but I can't do it right here, and I have no feeling in there. So face the danger of this invasive method of surgical treatment, right? I have some shocking pictures after surgery. It was always really swollen. This was when I was 9 years old and they cut it from behind, so they had to cover all the face, and I had to eat through the nose. Yeah. And some point I had lymph drainage, but it doesn't work. It's not a lymphatic syndrome, so, you know. But what helped a lot was physiotherapy for the jaw. I will tell you about this. This is when I was 9 years old. And it's already with the cutout of the fatty cells in here. So I also have grown in the lips fat cells, and yeah, and a really sharp chin. So I went on with medical treatment in 2005 in Stuttgart in Marian Hospital. There's a doctor called Dr. Kretschmer. He didn't know about the diagnosis, but he did a good job, I think. Yeah, he was doing the bone work. He was cutting out the cheekbone. He was really cutting it out, turning it 3D and putting it back again, so it was not too forward, right? Then everything went like, how can I say? Everything was like coming to each other like a puzzle, you know? Then they were reducing the lip tissue, and yeah, so it gets more symmetric, you know? And the hardest part of it was cutting out the jaw on both sides to put it straight, right? They put it straight, and I mean, if the medicine doesn't work on the bones, this is something you have to go through if you want any result, but I will come to that point later as well. Then, after cutting the jaw and straighten it, I had another surgery with an artificial cord put in here to hang up the corner of the mouth. So it is already hung up, but it's, I mean, everything is like really complex. So they always told me when they did there something else happened anywhere else. So it's like a big house where you start something and then something else happens anywhere else. Yeah. And I had a biopsy in Tübingen in 2016. It's not that long ago. And they didn't know about PIK3CA. So there was no outcome. Yeah. When they reduced tissue from my lips, because they were like grown more in here, they at the same time put it fat in the other lip, so it gets a bit more symmetric. And it was a smart part of it, I think. It was really smart to do some symmetrical work. Yeah. And they also reduced the length of my lips, because it was longer here, so they reduced a bit of the length. I have some pictures again. It was swollen a really lot. It is a heavy thing to go through. I think everyone who knows knows this, and it is a process. This is they took the fat out of my not fatty belly and put it into the normal lip. Yeah. Yeah, that's it. This is a really bad picture, but I think you can see. This is they already straightened the chin, but this is before the jaw was moved. And you see here the cheekbone is also really malformated, so it's just before all this. I have some before-after pictures. It's not the best ones, but I think you have maybe a result. This is really like, it's really like this. The jaw was really like this, and the cheek was more onto that side. And yeah, now you can see me. It's a bit different. You have a much more straighter jaw. And yeah, they put the scar into that wrinkle, so it's more like a normal thing. Yeah. Yeah. I mean, it's not cured, but it's much better. For me, it's much better, yeah. So I will tell you something short about tattooing, because when you straighten up some areas, but with me it was like the rosy thing of the lip was coming out. So it was straightening it up, and the rosy thing of the lip was coming out. So my own decision was to go to some kind of permanent makeup artist and to put some white into it and some red onto the lips. It was very natural. You have to be careful with this because it can look like a clown if you get the wrong one. But it was really effective for me because my lips looked really much more symmetric afterwards. I mean, they're still like down hanging, but those lips as they are, they look more symmetric. Yeah. So we did some contouring and some whitening in the corner of the mouth. Yeah. And orthodontics treatment, I have to say, this lasted a lot longer than anything else. It started when I was 7 and ended in 2010. I don't have these not grown roots. My roots are there, and we could treat the teeth, and we did. I had any braces ever invented, but I really had also. You don't see it now. I have really straight teeth, but they were grown in 2 rows, and they were like wavy, like this. And everything was really deformed, but we widened the palate and the occlusion. So we made some space, made out some tooth. I say we. I was just some part of it, but. Yeah, so we widened everything and then put everything back together somehow, right? But it lasted very long. So it was a journey of like, I can't, you know. Yeah, but this was like a really good connection between my orthodontist and my surgical doctor. They really connected, and I had braces to how can I say that? I had braces so the tooth didn't move while I had surgery. So everything went together very well. So yeah. Then it was like really long. I met someone with the same condition. I mean, we can all relate. We met Vilma, I mean, the most of us, through the internet. For me, it was 2020, so I was 33 years old. And it was a really strange idea. I wanted to become an influencer. And then I just looked up how to be an influencer. And then they told me, just like random pictures. And I scrolled and liked random pictures. And at some point, your picture appeared. And I've never been so active in social media, and suddenly your picture appeared. It was this one. I mean, many people of you know this picture. I liked it, and I knew instantly that this is the same thing that I have. I've never seen someone before. They also told me I'm the only one and stuff like that. Yeah. And this is when we met. We met at our half-timbered house. It's better now. It's a bit, yeah. And I have this picture. It's still like that. There's no cure, you know. It's just getting better. I had a biopsy, final diagnosis, facial infiltrating mosaic, and it's not hereditary. So, yeah, but it took 2 years. I had a biopsy, and the results came 2 years after the biopsy. So, yeah. And I have some conclusion to tell you. I want to recommend that everything should be accompanied by some psychological treatment. No one ever mentions this. No one ever told me that we should talk about this or just include it into life at some point. And that's a great recommendation I have to make, because there was no psychologist in my journey, nowhere ever. So maybe some of you need someone to talk to about this topic, right? I'm really curious about the medical treatment, but I'm also curious about educational work. I think it's the Smile Don't Stare motto. We should spread the word and make us so you see us, right? And for the parents, don't push your children into treatment. You're always asking when to treat, when to begin treatment. So talk to your children. My mother, she was a bit pushy. She was always like, there's a nail, I have a hammer. So she was like this nail hammer principle, right? And doctors also were like that. Oh, there is something we have to cure. That's it. Although for me, it was no bodily obstacle. It's just optical. So for me, it was just that. Okay, and be strengthening, be loving, be insightful. That would be great. And current challenges, educational work. And I'm working on a book project. It's called They Said Chernobyl, because that's what they first assumed. And that's my part. Thank you.